Chapter 3. Cancer Metastasis. In this chapter, we'll explore how cancer spreads from one part of the body to another. This process, known as metastasis, is a hallmark of malignant tumors and is responsible for the vast majority of cancer-related deaths. Understanding how cancer travels and invades distant organs is essential for diagnosing, staging, and treating the disease. We'll examine the biological mechanisms behind metastasis, including angiogenesis, invasion, and the roles of key genes. Metastasis is the term used when cancer cells break away from the original tumor and spread to distant parts of the body. These cells often travel through the bloodstream or lymphatic system. Once they settle in a new area, they can form secondary tumors. This process is what transforms a localized cancer into a systemic disease. Metastasis significantly complicates treatment and greatly reduces survival outcomes. Tumors need a blood supply to grow beyond a certain size. Angiogenesis is the process by which tumors stimulate the formation of new blood vessels. This is done by releasing growth factors like VEGF and FGF. These molecules signal nearby endothelial cells to build new capillaries into the tumor mass. Without angiogenesis, tumors remain small or dormant due to lack of oxygen and nutrients. Several proteins serve as activators of angiogenesis. Vascular endothelial growth factor, or VEGF, fibroblast growth factor, or FGF, and interleukin-8, or IL-8, are among the most prominent. These proteins bind to receptors on endothelial cells, promoting growth and movement into tumor tissue. The result is a network of vessels that supports tumor expansion. Angiogenesis is one of the earliest steps in tumor progression and metastasis. Just as some molecules stimulate blood vessel growth, others suppress it. Angiostatin, endostatin, and thrombospondin are natural inhibitors of angiogenesis. These molecules can prevent tumors from growing by cutting off their blood supply. Therapies targeting angiogenesis inhibitors are currently used in some cancer treatments. Maintaining a balance between activators and inhibitors determines whether a tumor will remain dormant or grow aggressively. Tumor dormancy occurs when microscopic metastases remain inactive for long periods. This often happens when angiogenesis is inhibited and the cancer cannot access adequate blood supply. Primary tumors can secrete molecules like angiostatin to suppress blood vessel growth at distant sites. This keeps micrometastases in check temporarily. However, changes in the environment or loss of inhibition can reactivate dormant cancer cells. For metastasis to occur, cancer cells must first invade surrounding tissues. This starts with the detachment of cells from the primary tumor. Once detached, they navigate through the extracellular matrix. This invasive behavior requires multiple adaptations, including altered adhesion and enzyme production. Invasion is the initial step that sets the metastatic cascade into motion. Cancer cells secrete proteases, enzymes that break down structural barriers in tissues. Plasmin and matrix metalloproteinases (MMPs) are especially important in this process. They degrade the extracellular matrix and basal membrane, clearing a path for cell migration. This not only enables invasion, but also allows cancer cells to enter blood vessels. Proteases are common targets in anti-metastatic therapies. Once cancer cells enter the bloodstream or lymphatic vessels, they travel to new sites. The cells often lodge in capillary beds of specific organs, where they may form secondary tumors. Common metastatic sites include the lungs, liver, bones, and brain. This spread is not random. Certain cancers tend to metastasize to specific organs. Understanding these pathways is key to managing advanced disease. Some cancers exhibit preferences for particular organs, a concept known as organ tropism. Stephen Paget's seed and soil hypothesis explains this by suggesting that metastatic cells or seeds only thrive in certain tissue environments or soil. For example, prostate cancer cells frequently metastasize to bone, while colon cancer often spreads to the liver. These tendencies help inform treatment and monitoring strategies. The interaction between tumor cells and host tissues determines where metastasis occurs. E-cadherin is a protein that helps cells stick together. In cancer, this protein is often lost or downregulated, allowing cells to detach more easily. This loss of adhesion facilitates invasion and migration. Without E-cadherin, cells can slip through tissue barriers and travel more freely. Restoring or mimicking its function is a possible avenue for therapy. The immune system plays a dual role in metastasis. It can attack cancer cells, but it can also be evaded. Cancer cells may downregulate their major histocompatibility complex or MHC markers to avoid detection. Cytotoxic T cells fail to recognize these stealthy cells. Some tumors also suppress immune responses in their environment. Strengthening immune recognition is the goal of many immunotherapy strategies. Certain genes, known as metastasis suppressor genes, act to slow or prevent the spread of cancer. Examples include $1 which codes for E-cadherin, as well as KIS1 and BRMS1. These genes inhibit cell movement, invasion, and colonization of new tissues. Loss of their function can accelerate metastasis. Studying these genes has opened new doors for targeted treatment. On the flip side, some genes actively promote metastasis. A key example is the Twist gene, which plays a role in epithelial mesenchymal transition, or EMT. This process gives cancer cells greater mobility and invasiveness. Other genes activate similar pathways that allow cancer to spread. Targeting these genes may reduce the metastatic potential of aggressive tumors. Controlling metastasis is one of the greatest challenges in cancer therapy. Treatments aim to inhibit proteases, block angiogenesis, and enhance immune responses. Drugs like bevacizumab target VEGF to limit blood vessel formation. Immunotherapies aim to reawaken the immune system to detect and destroy metastatic cells. The future of cancer treatment depends on understanding and disrupting the metastatic process.